Marshfield Medical Center Park Falls Home Health and Hospice facility is set to close on March 1st.
Our own Jake Force was in Park Falls yesterday and spoke to several people close to the situation and has more. Jake?
That's right. The Hospice Center, previously known as Flambeau Home Health and Hospice, is actually located in Phillips and has been serving the area for over 2 decades. But Marshfield Clinic said that due to a lack of resources, they will be closing this facility in 5 weeks. Yesterday afternoon, I was at a gathering at Birch Street Funeral Service in Park Falls and spoke with numerous folks who say that losing the facility will be a devastating blow to the community.
You know, we live in a predominantly elderly community. We're so rural. So the next nearest bigger city is 45 miles away. So it's really devastating that we wouldn't have those services available here.
With the Marshfield Medical Center Park Falls Home Health and Hospice facility set to close on March 1st, many have voiced concern that its departure will leave a hole in the community. Chris Karish still works part-time at Marshfield Medical Center in Park Falls and says the impact will not be limited to patients who are in their final days.
They're the most vulnerable. They need the most help. So without someone there to support you and the family, it's not even just about that person. They treat the whole family when they're in there.
Patty Terrell is a retired ER nurse from Marshfield Medical Center, Park Falls. She says the closing of the hospice facility is an absolute travesty for the community. Terrell feels for the people who will lose their jobs, but also the family members of patients who will have to look for new avenues of care.
If you have a loved one at home, it's you by yourself 24/7, and just physically and mentally, you just need other people that are going to be able to help support you through that crisis that's going on in your life, no matter what it is.
Marshfield says they have worked with other licensed home and hospice providers to ensure patients will continue receiving care. But Beth Hahn, who is a former director of the hospice facility, says this will not solve the problem.
The problem with this is the fact that they don't have any local care providers. They're all serving from agencies 1 to 2 hours away. So I feel that the community is not being served appropriately by these other agencies that are too far away.
Gail Strobach currently works as a nurse at the facility that is closing. She became emotional when noting that the loss of the home health and hospice care will not just impact older patients in the area.
I think that it's just a common fallacy that our hospice patients are elderly. Over the course of the 6 years I've worked for them, it seems we are having a younger and younger clientele, and I can't imagine what they would have done without us.
In a statement emailed to Newswatch 12, Marshfield Clinic said they are closing the hospice facility due to limited resources. They will continue to provide primary, specialty, and hospital care throughout the region. To see their full statement, you can visit this story on our website, wjfw.com.